Odrofo higher golden TV GH best also be subscribe like na share for me na ye nche wono yen kopi mo yen ra John Dramani Mahama Ghana PAC yen president ashe yinyina yin so kopi mo US na US kopi mo no na oye nhye mudie bi na wo kan say Accra nkran wa besisa no ma Accra yom kwan obefa so aye eni tutuye eni project no send ba be obeye ne nyina no odi ne nyina tudwa wo Donald Trump krum USA ntino yencha hono mo yenkohwe ntema hodo a yenra John Dramani Mahama aka about say the resetting agenda of Accra na say nkran oba be yen fufuro no.
The long and short was two things came out of it. And the first was the Accra Compact. And the Accra Compact targeted mainly three things. One, to promote health sovereignty. And the second was how to reform the global health system. And the third was how we can foster sustainable funding for healthcare. And so that was the crux of the Accra Compact. But apart from that, there was also the Accra Reset, which is what you see here. And Accra Reset is broader. President Obasanjo handed the responsibility to me because I'm the champion of African financial institutions and said that this, in a way, falls within your remit to decide how we're going to restructure the world governance system, especially considering that the old models are going out of date. Multilateralism is coming into an end. And so you must add this to the responsibility. And so we're happy that we have the opportunity on the sidelines of the UN to further the conversations that we started in Accra. And I want to thank all of you who have found time to join us to come and contribute your ideas, to be able to look forward into the future and see what models we can adopt going forward. A lot of responsibility rests on the shoulders of Africa itself. We need a reset in our countries. In Ghana, we have started our reset. And the reset focuses on the fact that we can rechannel resources into areas of priority. And I'll give just one example. I'll say it later in my speech. We have a national health insurance levy, and the levy funds the national health insurance scheme. And more than 18 million Ghanaians have national health insurance card that allow them access to free health care at the point of service. They pay a little annual premium. Now, the government before capped this fund, all statutory funds actually. And so if monies coming into the statutory funds exceeded a certain level, the excess went into the consolidated fund. And the consolidated fund is used for all kinds of things: consumption, goods and services, salaries and wages, and all that. And so one of the first things we did, noticing the shortage of funding for healthcare, was to just uncap the fund. And when we uncapped the fund, it resulted in additional revenue into the National Health Insurance Scheme of 350 billion Ghana cedis. No, 3.5 billion Ghana cedis, which in dollars, let's put it in US dollars, will come to about $300 million. You can imagine what $300 million can do. And so immediately from $300 million, we're able to cover the USAID gap in funding so that the programs that we were funding through USAID could continue. And so there's a kind of innovative thinking that we need to do. And a lot of that depends on us as leaders to be able to look at how we can move resources from other areas that are not priority into areas that are priority and have tangible benefits for our people. Like I said, I still have an opportunity to speak. I'll leave it here. Adam, thank you very much. And I hope Baba Olusegun Obasanjo arrives anytime soon. Thank you.
Minister, Ghana clearly is one of the pace setters in leading this discussion or thought leadership around governance of a reimagined global architecture. What does reset mean to you in practice in Ghana, especially in the back of this defunding that has happened? Thank you.
Thank you very much, Edem. This is how we see reset in Ghana. Reset means domestic resource mobilization. Reset means doing the right investment in the sector. That investment must respond to the needs of the people. Reset means sustainability. And reset does not mean isolation. You know, before I became minister responsible for health, I was a member of parliament, and I'm still a member of parliament anyway, from a rural constituency. And so I appreciate that when that small child in the village gets vaccinated at the right time, when that pregnant woman in the village gets the insecticide-treated net. See, in Ghana, we have the highest political will when it comes to reset because it's being led by the president himself. And as he has already indicated, one of the major reforms he made in the country was to uncap the national health insurance. And what is very interesting about uncapping the national health insurance is that that revenue, that money, that 300 million he made mention of, was used where it's needed most. And so today in Ghana, we are rolling out free primary health care. We know that cost is a barrier to primary health care. In order to achieve the universal health coverage, in order to do the right screenings on time, in order to detect the diseases at their early stages, we are talking about NCDs, we have to remove the financial barrier with respect to primary health care. Another very interesting thing that is happening in Ghana is that we are supporting specialist care, specialist level care. And you hear funds like Ghana Medical Trust Fund, popularly known as Mahama Cares, named after our president. And this is dedicated towards the funding of specialist care. You know, and so these are major reforms that we are undertaking in Ghana. And the most interesting aspect, whether the national health insurance or the Mahama Cares, these are domestic mobilization of resources. And therefore, we have absolute control and nobody dictates for us how to spend the money. And you see that we are using the money for the right purpose. His Excellency, the President, is determined to make Ghana a pharmaceutical hub. And in fact, to even make it a hub for the production of vaccines. We learned through the bitter way during the COVID pandemic. We want to avoid a situation where a country will determine when we get vaccines in Ghana. So this is what the reset means. But you see, in all this, it makes sense to the Kenyan in Kisumu, the Togolese in Lome, the Ghanaian in Wa, when that person has quality health care, finito, irrespective of the person's location, irrespective of the person's status in society, irrespective of how much the person earns. And we must do the right investment for the right dividend. And I think that along the process, we may need partnership, but that partnership must make sense. That partnership must not come with prescriptions. I thank you for the opportunity.
Thank you. Thank you so much.
I just want to make two quick notes. Tomorrow, we have a side event on African financial institutions. And so there's a direct link between what we're doing today and what is going to happen tomorrow. So as many of you who can should join us. I also want to agree with what Peter said, that this is a process, it's not an event. And so we're in for the long haul. And so let us work together in solidarity to see our objectives realized. I'll just read this to put it on record. It's an honor to address you today at this historic gathering. Allow me to begin by warmly welcoming you and expressing my sincere appreciation for your dedication to the cause of development and global solidarity. Only weeks ago in Accra, Ghana, we convened the Africa Health Sovereignty Summit, leaders from across Africa and the wider world, including Presidents Obasanjo and Ellen Johnson Sirleaf, the Global Director for the World Health Organization, Tedros, representatives of the African Union, development finance institutions, ministers, business leaders, and civil society joined us to chart a new course. I want to extend my heartfelt gratitude to all who found time to come to Accra and who lent their voices and vision and who helped us launch what is now becoming a global agenda. As African Union champion for African financial institutions, I carry a mandate to help shape the future of our continent's financial architecture. As a continent's advocate for reparations, I am also deeply aware of the failings of the world's moral order. That responsibility is also why I'm passionate about the Accra Reset. For I know that without new governance, business and financing models for development, there can be no sustainable path for health, no resilience for our economies, and no workable future for global solidarity. That summit produced a resounding consensus. The health crisis we face is not only a crisis of disease, vaccines, and hospitals, but also a crisis of social and economic inequality. It is a symptom of a deeper malaise in the global development architecture itself. The collapse of the legacy aid system, punishing debt burdens in the global south, and fragmented supply chains are not isolated problems. The evidence that the very logic of global development as we have known it is no longer fit for purpose. From Accra, a message went out to the world. If we are to heal our health systems, we must first reset development itself. Excellencies, we meet here in New York at a time of increasing global uncertainty. Humanity has made progress once unimaginable. In 1990, 36% of the world lived in extreme poverty. By 2019, that figure had fallen to 8%. Global life expectancy has risen by nearly a decade in just one generation. Maternal mortality has declined by a third since the year 2000. In global health, since 2000 alone, more than 50 million lives have been saved through expanded access to vaccines, HIV treatment, and malaria prevention. The Global Fund and Gavi, born out of a new development consensus 2 decades ago, have provided life-saving tools to billions of the world's population. This progress deserves recognition. It reminds us of what becomes possible when global solidarity rises to meet global challenges. And yet, even as we celebrate these gains, the cracks in the global order are growing deeper. The question that agitates our mind is, how do we sustain these gains in the face of current global shifts? The COVID-19 pandemic erased 2 decades of poverty reduction in less than 2 years. Climate change has driven nearly 735 million people back into chronic hunger. Almost one in 10 of the world's population is facing chronic hunger. Developing countries now spend more on servicing external death than they do on healthcare and education combined. Africa's external debt stock alone exceeds $1 trillion in 2023, with debt service consuming nearly 1/5 of government revenues in many African countries. The MDGs and SDGs have been the lodestar of global ambition. The MDGs lifted over 1 billion people out of poverty. The SDGs galvanized unprecedented cooperation. However, the UN's own 2023 report indicates that fewer than half of the 169 SDG targets are on track. In health, in inequality, and in fiscal resilience, the situation is particularly dire. The temptation will be to prepare another catalog of partnership global targeting. ODA is declining, and there's reportedly an overall 40% reduction in worldwide humanitarian assistance. We need to strategize. The world needs a reset, a re-engineering of the very logic of development itself. And this is the vision of the Accra Reset: to rebuild global development around sovereignty, workability, and shared value. To make it possible to co-invest, co-design, and co-create for shared priorities. Health, along the most aid-dependent sector, is our proof of concept. Through the sustained framework, the 4D innovations platforms such as Panabios, Prosper, and the African Continental Free Trade Area Hub, now augmented by the Health Investment Multiplier and Synergy tools, along with a new global health architecture and governance framework, we're pioneering models that move from dependency to sovereignty. Already more than $1 billion in reset-compatible pledges from African development finance institutions and private banks have been aligned with a new approach through the pooled pledge and deal rooms arrangements. And while we launch this reset today, let us acknowledge that others have already been at work. From President Paul Kagame's leadership under the Lusaka Agenda to the Africa CDC and the African Medicines Agency, proving that sovereignty-led models are not only possible, but practical. Working together, we will not only sustain these gains, but also expand them and utilize them to protect the well-being of our people. But health is only the beginning. Africa is only our starting point. The reset looks beyond today's crisis and identifies new pivots of growth: biodiversity, climate resilience, nutrition, and empowerment economies. These are not only moral imperatives, but trillion-dollar opportunities for inclusive, climate-positive prosperity. The IMF estimates that emerging markets and developing economies will require $2.5 trillion annually in climate finance by 2030. Without new governance, business finance models, these needs will remain unmet. And so we must move from vision to operating models. The reset is anchored on three fundamental shifts. The first is a mindset shift. This is needed, recognizing that we live in an era of unpredictability. The post-war multilateral era is being ripped apart. It appears we must prepare for a period of global turbulence. The second is a focus shift, moving from beyond crafting new lists of global goals to building executable business models for coalitions, syndicates, and platforms that deliver. And the third is a reality shift, accepting that diverse, even contradictory interests are now a permanent feature of our system. And turning these very tensions into the fuel for pragmatic cooperation and mutual investment is imperative. This new model demands resource multiplication and not rationing. Instead of limiting resilience, let us multiply it. Instead of setting new spending targets, let us measure the additional value that health, climate resilience, and food security can contribute to the global economy. To give this reset shape, we must launch a new global coalition, a partnership of the willing, the beginnings of a durable club, a presidential council comprising heads of state and government from Africa, Asia, Latin America, and beyond, which will provide political leadership to this movement. A high-level panel drawing from health, finance, innovation, and business will provide intellectual depth and evidence to this exercise. Together, this coalition will apply the operating logic of the reset to help the world rethink global development itself. It will work collaboratively with the United Nations, with regional institutions, and with the private sector to drive global thought leadership, while also serving as a platform to test and refine the new models we're looking at. Health will be our first ground of experimentation, but the lessons learned will be shared across all sectors, from climate resilience to nutrition to empowerment of our economies. In doing so, we'll drive sector strategy labs and pioneer the spirit of workability. We are discussing geostrategic deal rooms to facilitate risk sharing, investment in health, climate, food security, and job creation. But our mission goes further. It will help shape the post-SDG agenda. The world is only 5 years away from 2030. And the question is not simply what new targets should replace the SDGs, but how we design institutions and financing systems that can actually deliver. This means thinking outside the box, about new and innovative financing instruments, about fresh business models, and about smarter coalitions that multiply rather than ration resources. The Presidential Council and the high-level panel will help the world confront big questions. How do we govern in a poly-crisis era, where shocks are a permanent feature of our daily lives? How do we unlock trillions in climate finance without drowning countries in debt? How do we turn sovereignty into a multiplier of value rather than a barrier to cooperation? These are the challenges that the Accra Reset seeks to address, and the eminent minds and hearts gathered here today will be the driving force behind creating designs and executing solutions. I want to take the opportunity to thank the many leaders in Africa, Asia, Latin America, and the Caribbean, as well as our partners in the West, alongside business leaders, global multilateral institutions who have already welcomed this initiative and are collaborating to make it a success. Their support affirms that the reset is not only African in its origins, but global in its reach and its relevance. It is indeed right that the Global South should take the lead, for it is in our countries that the collapse of the old world model will be felt most acutely. And it is from our innovations that the world can find new answers and solutions. The reset is not a rejection of what has been achieved. It is the next phase of global development. Africa's invitation is to co-create a new operating system for world progress. The last major attempt to reset global development came with the Monterrey Consensus in 2001. For the first time, multilateralism formally shifted from a paternalistic approach to a partnership-based one. Health was at the forefront of this effort. Faced with HIV/AIDS crisis, African leaders like Kofi Annan and Olusegun Obasanjo galvanized the world. Their leadership produced enduring institutions such as the Global Fund to fight AIDS, tuberculosis, and malaria, and Gavi, the Vaccine Alliance, which were designed to embody the Monterrey principles in their governance and implementation. Much good was achieved and millions of lives were saved. The world again faces a choice, a crisis or reset. And just as Montero sought to re-engineer development 25 years ago, today's fragility calls for a new vision of global multilateralism. Health is once again at the forefront of this transformation, like it was then. It is the sector that is most exposed to the failures of aid dependency, but also the sector best positioned to provide sovereignty-led models that can succeed. We call on governments, innovators, financiers, and civil society to join this movement, to move from catalogs of need to engines of value creation, to redeem the promise of development for the post-SDG era. In conclusion, history will ask whether this generation, in the face of crisis, rose to the occasion. And I believe that we can summon the same courage that people like Kofi Annan and Olusegun Obasanjo and other world leaders mastered when they mobilized the world against HIV and AIDS. And so let us channel that same spirit today, not only for health, but for financing and strategizing development itself in a fractured but yet still interdependent world. Let this be a positive turning point where we rise as partners and take our destiny into our own hands for the present and future generations of the world. I thank you.